Hello there today. Scott Thornhill here, Care and Prevention 2. We are going to go now over our Scat test, our Sports Concussion Awareness Tool. There are 5 steps in this. We're going to start out with our athletic background. Athletic background is I'm basically asking the patient to go through what sport they're in, what date the injury occurred, the year in school they are, the age, gender, what's their dominant foot or hand, how many diagnosed concussions have they had in the past, what is the most recent concussion, how long was the recovery, and then also follow up as has the athlete been hospitalized for head injuries, diagnosed or treated with headache disorder or migraines, diagnosed with learning disability or dyslexia, diagnosed with ADD or ADHD, diagnosed with depression, anxiety, or other psychiatric disorders. If they answered a yes to any of those questions on the form, we have space to fill that out. Then we will go to a systems check evaluation. There are 22 questions on there, and they are worth up to 132 points. None is 0, mild is 1 to 2, moderate 3 to 4, and severe is a 5 to 6. These questions range from headaches to sensitivity to noise, difficulty concentrating, confusion, nervous, anxiety. So basically you would add up all of those systems that they did check for. We would add up the total between the 0 and 132 and put that in. Do this, and then we follow up those questions with, do the symptoms get worse with physical activity? And do the symptoms get worse with mental activity? And if 100% is feeling perfectly normal, what percent of normal do you feel right now? If they don't answer I'm 100%, we have space. We're going to fill out why is it that you don't feel 100%. Okay. Moving on to the cognitive screening. So my patient, I will go through and ask, what month is it?
May.
What is the date today?
The 28th.
What is the day of the week?
Saturday.
What year is it?
2022.
What time is it right now?
7:10.
Good job. So she got all of those right. So that's a 5 out of 5. So then we're going to move on to an immediate memory test. This is a list of words that I'm going to give. I would give this list of words 3 times and I would score each time. So if they got all the words right the first time, I give it a 5. If they missed 2, I give it a 3. And then if they get all 5 right, I give it a 5 and add those points up. So right now I'm going to give you elbow, apple, carpet, saddle, and bubble.
Elbow, apple, carpet, saddle, bubble.
That's 5. All right, fantastic job. Then we would move on to a math in reverse order. So I give a list of numbers. There is a range from 3 numbers all the way up to 6 numbers that I could give, depending if I start to see a little bit of discrepancy in the numbers that they get back to me, I can change it up. But for right now, I will give you, and you're going to give this back to me in reverse order. I'm going to give you 3, 2, 7, 9.
9, 7, 2, 3.
Perfect. Now for the hardest test of all, we're going to do months in reverse. So you're going to start with December, November, and so on.
December, November, October, September, August, July, June, May, April, March, February, and January.
Fantastic job. All right. Now moving on to the neurological screening. Basically, we want to test, can they read aloud? Can they read some directions? And then we would ask for moving the head. I would first conduct, we're going to, is there pain when I move your head? And the answer would be
No.
no. Okay. And then can you move your head side to side and up and down?
My
Side
head.
to side. Okay. Now stationary, looking side to side and up and down, do you get any dizziness or double vision?
No.
And then can the patient perform the finger-nose coordination test? So this is basically 5 seconds, or yes, 5 touches in 4 seconds. So. I think you did it. So fantastic job on that. No, we don't. Now, they also need to get up and do the walking gait. So basically what they're going to do is put 1 foot in front of the other and take about 3 or 4 steps across. I'm looking for balance issues or having to look down. I want the head up and doing that. You can take your seat again. And then we will go back and we will actually do the best test again. So they will do the double leg stance, hands on hips, eyes closed. They will do the single leg of the non-dominant foot. And then they will do the tandem stance. Again, all of these, eyes closed, hands on hips, 20 seconds. And I'm counting for any sort of movement in the hips, off balance, flexion in the foot, the heels come off the ground, hands off the hips, open the eyes to get their balance again, okay? And then my last one is delay recall. Can you recall those words that I gave you earlier?
Elbow, apple, carrot, carpet, and that's it.
All right, so she got 3 out of 5, so I would mark that down as well. All right, thank you.